Hi, Helen, how are you?
I'm good, thank you. How are you?
Good. Can you hear me?
I can hear you a little.
Are you ready with your presentation?
Yes, I am.
So, friends, let me welcome Helen, who joined us from Birmingham, woken up early just on a Saturday holiday to share with us her experience. So, Helen, if you could share your presentation. Go on to the slide.
Can you see that? Pardon?
Yes, please go on. You can hear me clearly.
Okay, perfect. Thank you. Hello, thank you for the introduction. So, as Aaron said, my name's Helen Horton. I am a registered dietitian from Birmingham in the United Kingdom. And today I'm going to be talking about the rational combination of diet and exercise. So just a brief bit about my professional background just to start. So currently I'm working as a bariatric and research dietitian at University Hospitals Birmingham, and that's for 4 days each week. And then for 1 day a week, I'm at Birmingham University and I'm on a course for clinical academics, learning all about the research skills needed to become a proper clinical academic. So in my previous experience, I've been working as a dietitian for quite a few years now, probably about 5 or 6, and I've got experience in bariatrics, weight management, oncology, and also general medicine. So this is just a brief outline about what I'll be covering today. Firstly, I'll be going through the current recommended guidelines for exercise. Then I'll talk about how we can adapt exercise for people living with obesity. I'll be talking about some of the exercise considerations following bariatric surgery and some of the dietary considerations that go alongside those. And then I think we're doing questions at the end of all 3 of our presentations. So these are the current recommended physical activity guidelines for adults. So if you're interested in the guidelines for children, adolescents, or older people, these are also available on the World Health Organization website. So just to go through the adult recommendations, we recommend that adults do at least 150 minutes of moderate intensity aerobic activity each week, or they can do 75 minutes of vigorous intensity aerobic activity, or an equivalent combination of moderate and vigorous. This should be performed in at least 10-minute bouts at a time. And for additional health benefits, adults should actually double the above guidelines, so doing 300 minutes of moderate intensity activity or 150 minutes of vigorous intensity activity. And also, adults should be doing 2 days or more of muscle strengthening activities in addition to the aerobic. So that's just a brief outline of the current recommendations. And this is a nice infographic that I got from the UK government website. And I think it just nicely conveys all the messages that we're trying to cover in regards to physical activity. So moderate intensity activity you can see here on the left of the presentation, and that would be things like swimming, going on a brisk walk or cycling. But some other examples I have here would be doing some water aerobics or doing doubles tennis, pushing a lawnmower, hiking or volleyball. Whereas the vigorous intensity activity would be things like running, running up the stairs, doing sports, things like aerobics, football, using a skipping rope, martial arts. All these things are classed as more vigorous intensity activity. And the difference between the two is the moderate intensity activity should increase your breathing, but you should still be able to talk to the person beside you. Whereas the vigorous intensity activity, you should be quite short of breath when you're doing those sorts of activities. And then, of course, in the middle, building strength. So building strength to keep muscles, bones and joints strong for 2 days a week. So we know that exercise is good for us, but why is it so hard to lose weight even when doing exercise? So we have patients come to clinic time and time again saying that they've tried exercising in the past, but they're struggling to lose weight. They sometimes even gain weight. So this article by King et al. In 2007 nicely sort of summarised why that could be. And they summarised that perhaps it's due to compensatory responses to having a negative energy balance. So these could be automatic, so metabolic responses. So when we exercise, we know that our resting metabolic rate can reduce, which makes it more difficult to lose weight. Or they could be volitional. So if we're exercising, we're more likely to potentially have a snack beforehand or a snack afterwards, which could potentially counteract the fact that you're losing all these calories from exercise. So it's important to think of these 2 or 3 things when exercising, as well as trying to lose weight. That being said, there's been many studies that have actually shown that exercise alongside bariatric surgery is actually really beneficial and can create a lot more weight loss than bariatric surgery alone. So this is just one of many studies by Egbert et al. From 2012, and it's a systematic review of 17 publications exploring exercise in bariatric patients. And in 15 of these studies, there was actually a positive relationship shown, and meta-analysis demonstrated that in patients participating in exercise, a standardized mean of 3.62 kilograms greater weight loss compared to the moderate exercise group. So we know that exercise is good for us, and we know that bariatric patients potentially lose more weight if they're exercising, but there are obviously many barriers to physical activity, and I've just sort of put a few of them here on this diagram here, but there's obviously many more that you might experience in practice. So patients might find it difficult to find fitness clothing that actually fits them in their larger sizes. People might suffer with sweat rashes or chafing, which would make exercise unappealing to continue or to do again. People might feel embarrassed if they're exercising, and they might be worried about equipment holding their weights. They may not be able to keep up with the rest of the class. For example, if they're doing an aerobics class, they might be falling behind, and that could lead to further embarrassment. And even people have told me that they're too scared to exercise because they have a fear of having a heart attack and something going wrong with their health while they're exercising. So these are just some of the barriers that we can have to physical activity, especially in people living with obesity. So with that in mind, there are lots of ways that we advise to adapt exercise for people living with obesity. And these are just a few of the things that we recommend. So firstly, chair exercises. They're a great alternative for people who struggle with their mobility. And there's just a few examples here on the side of the screen. Things like chest stretches, upper body twists, hip marching. I got this, this leaflet from the NHS website, but there's lots of different available resources. There's also something called the Couch to 5K running plan, which is a series of podcasts. So week by week, they build you up from just doing 30 seconds of running at a time, all the way up to around 30 minutes. So it gradually builds you up and gets people's confidence up with exercising and jogging. Advising 10-minute workouts, so doing short bursts of activity rather than thinking that they have to go to a full 60-minute exercise lesson, just doing 10 minutes at a time and still teaching people that that is still beneficial for their health. Aiming for 10,000 steps each day. So if people aren't managing 10,000 steps, just ask what they're managing now and gradually build it up, sort of 100 steps each week, for example. Advising fitness videos, so there's loads of YouTube videos, great exercise classes online, and if people are worried about going to the gym, if they're embarrassed, then they can do that from the comfort of their own home, so it's a lot more achievable for many people. And then just some simple things like parking the car a little further away from the office, going for a walk in your lunch break, taking the kids to and from school, and then planning active activities at the weekend, things that get you outside and get you moving. So these are just some of the examples that we use to help to adapt exercise for people living with obesity. And most importantly, the bottom bullet point, so reminding patients that exercise doesn't just mean the gym, it can mean all these things, and it sort of can be inclusive for everybody. So thinking more about the exercise considerations following bariatric surgery, So the main question that I get asked in my practice is, when can I start exercising following bariatric surgery? And the answer is, it will differ from surgeon to surgeon, from centre to centre. Everyone might recommend a slightly different process, but we advise to get up and moving as soon as possible to get the blood flowing, to hopefully reduce the risk of getting any blood clots or anything post-op. So get up as soon as able. And then before wounds are healed, focus on getting back to doing normal activities, things like washing the dishes, doing things around the house, doing relaxation exercises and deep breathing, and then going for short walks. So take it easy before the wounds are healed. And then once the wounds are healed, incorporate things like swimming, longer walks, and some low intensity aerobic activity. We do advise to avoid heavy lifting or abdominal exercises for around 2 months after the operation, but it could be longer if you're struggling to heal. And obviously, if open surgery is performed rather than laparoscopic, the recovery time will be slightly longer, and therefore take caution when building the exercise tolerance. We do advise to try and build up to the recommendations that I showed you on the earlier slides, so including the aerobic exercise and the weight resistance exercise to get the most benefits out of your exercise following bariatric surgery. And also always reminding the patients of why we recommend exercise following bariatric surgery. So I've just listed a few of the main points here. So exercise can really improve skin elasticity after a bariatric surgery, and it can help to maintain weight loss. So a lot of patients say that they lose weight really well in the first year, even the second year, and then they might notice that weight starts to come back on again. So we do recommend starting to get some exercise into their routine, because that can really tend to help to reduce that weight regain. It also helps to preserve and build lean muscle, of course, and it can boost metabolism, enhance self-esteem, and build new social networks. So some patients may have many social networks that are around unhealthy things like going out to eat, going out to drink alcohol. All these things won't help with their weight loss journey. But if they can build social networks through fitness, that can be a great way to keep them in a social network and help them with their weight loss. And also exercise can, of course, reduce the risk of developing comorbidities, things like diabetes and cardiovascular disease. So reminding them of why they're doing it, it can really enhance their health. And of course, exercise can improve mood and reduce anxiety. So there are many benefits to exercise following bariatric surgery. And I'd just like to remind patients, if they are struggling, to come back to a list like this to remind themselves to keep going. So just going into some of the dietary considerations following bariatric surgery. Firstly, water. So it can be difficult to keep hydrated following bariatric surgery due to perhaps having a smaller stomach or being able to manage slightly less water at a time. So we do encourage small sips throughout the workout and adequate intake in the day beforehand and after to keep themselves well hydrated. Protein's obviously essential if we're exercising to build and repair muscle. However, often patients can regurgitate meat, which is obviously a great source of protein following bariatric surgery. So we do advise things like milk, yogurt, cheese, low-fat cheeses, fish, things that are easier to manage. And also, of course, always following the recommended eating techniques, so chewing well, waiting between each mouthful. All of these things can really help to manage more protein sources. Thinking more about carbohydrate. A lot of people use carbohydrates as an energy source when they're exercising before or afterwards. But just to keep in mind, obviously carbohydrates can lead to dumping syndrome. So keep that in mind with patients when advising for snacks around workouts, or choose complex carbohydrates to help hopefully reduce the risk of dumping syndrome. Things like brown rice, wholemeal bread, or wholemeal pasta. Thinking more about the meal size. So when we have bariatric surgery, the portion sizes we can manage can be quite small. We do have patients telling us perhaps they can only manage 1 tablespoon of food at a time. And this doesn't help to build the reserves you need to exercise. And it can lead to people feeling hungry or low in energy. So we say perhaps trying to have a meal replacement shake a couple of hours before activity to boost their levels ahead of time. And also reinforcing basic bariatric dietary advice. So if they do say that they're feeling hungry after bariatric surgery, reminding patients that although they're hungry, the portion sizes that will fill them will still be relatively small. So this is just an example on the screen of our 7-inch side plate. So keeping the portions really small and balancing the plate with, you know, the half vegetables or salad, 1/4 carbs and 1/4 protein. And reminding them not to put it on a big plate, because that's what it would look like on the larger plate, and that's not the portion that they'll probably need when they're exercising following bariatric surgery. Thank you. That was everything. I can, it's a bit quiet.
So the laptop mic is not able to pick up the sound of noise from the audience. I'll message you. I will message you.
Pardon?
Can you hear me?
I can hear you talking to me.
Yes, yes, I'm talking to you. Can you hear me now?
Yes.
Okay. Thank you very much. The audio from my side is not very good,
Okay.
but we could hear you very clearly. Thank you very much. I've
Okay.
recorded your talk as well, and I'll message to you.
Okay, thank you.
Thanks. Thank you very much. Bye-bye.
You're welcome.
So